I'm Lance DeLange with Yada Yada. This is a video we've put together to help you sort out and distinguish what you may have if you're having a hand problem. Its purpose is to help direct you to a more educational video once you might identify what your problem might be. The hand's a very complicated structure, as you know. There are multiple structures involved. There are tendons that will flex and extend the hand. There are nerves that come up to innervate the hand. There are multiple bones and muscles. We're going to talk about just some of the basic, most common problems you might experience with your hand. First off, let's talk about nerves. Two main problems that people will most commonly notice with their hand with nerves is carpal tunnel syndrome or perhaps cubital tunnel syndrome. Carpal tunnel syndrome specifically comes up to these 3 digits and this portion of the 4th digit. So if you're experiencing numbness specifically with these fingers, or particularly at night if you're sleeping and your hand goes numb and you notice that it's just these fingers, this may be carpal tunnel syndrome. And I would encourage you to watch our video, which will be linked below, to find out more about carpal tunnel syndrome. There's a different nerve that comes into the hand called the ulnar nerve. It comes up to just the 5th digit, the little finger, and the ulnar aspect of that same finger. So if you've ever hit your funny bone and your fingers go numb, that is the ulnar nerve. Most commonly, it would have a problem at the elbow called cubital tunnel. You can check out our video there. Or less likely but possible at Guillen's canal, where the nerve comes through a small area, similar to the carpal canal, that can cause numbness in this area. So if your numbness is specific to these 2 fingers, then check out our video on cubital tunnel or Guillen's canal. If your numbness is specific to these fingers, please check out our video on carpal tunnel syndrome. Another common problem with the hand that is often noticed is a problem called trigger finger. Each finger has a flexor tendon, several flexor tendons, but there's specifically some tendons that will flex the fingers, each individual finger down, as well as your thumb. A common issue that can occur is there can be some inflammation at A1 poli of the individual finger that can cause the finger to either snap as you're bending it, or cause it to get locked down and you have to release it. That can be with the thumb as well. If you're experiencing any of those issues with your finger getting stuck, or just not gliding but more of a ratcheted motion, please check out our video on trigger finger. If you notice a bump on your wrist, common places to get a bump could be here, or very common to get it here, but there's other possible locations. The 2 very common sources for this are a ganglion cyst. If it occurs in the wrist here, it's commonly referred to as a Bible bump. 2 of the most common locations to get this bump would be right here, or perhaps on the back of your hand. So if you're noticing a lump or bump there, which can be tender or limit your motion, please check out our video on ganglion cysts, also called a Bible bump. Another common problem with the hand is arthritis. Any of the different bones or joints, ends of the bones, can get arthritis in them. The most common would be the first CMC joint at the base of your thumb here. As we age, it's common to get arthritis here, and often you might notice a deformity, a bump, or you may simply have pain or difficulty gripping or holding on. So if the location of your pain is specifically here at the base of your thumb, please check out our video on arthritis of the first CMC joint of the hand. Tendinitis is also a common problem with the hand. If you notice when you flex your fingers, tendons coming from the forearm come through and attach to different locations in the hand and wrist and fingers. Any of those tendons can get a tendinitis from repetitive flexion or extension. Workers who do a lot with their hands, or guitarists or pianists, anyone who does a lot of repetitive activities can get a tendinitis. Those can be flexor tendons or extensor tendons. So if you're having pain here and without numbness, check out our video on tendinitis for the hand and wrist. Another problem that can occur in the hand is what's called a Dupatrons Contracture. It's possible to get some contractions or development of extra tissue similar to a scar tissue that can develop in the hand coming up into any of the fingers. This problem often can be noticed with a possibly tender or even non-tender, just a bump or lump in the hand. Over time, those can grow up into the fingers, and given enough time, those can cause a contracture down. You may notice a linear line or tenderness or the chronic inability to extend your fingers. If so, please check out our video on Dupatrons contractures. Another issue that can develop quite rapidly would be a mallet finger. Mallet finger occurs when there is a trauma to the tendon that attaches to the end of your bone. This can be traumatic, such as falling and landing on it. Sometimes if you grip or grab something hard. On occasion it can occur without rhyme or reason, but specifically it would leave a lag to your finger where you're unable to extend at this finger, at the joint. This can happen with any of the fingers. Quite commonly you would have tenderness behind. If you've developed these symptoms, please check out our video on mallet finger. This is just a brief summary of a few of the most common problems that can occur with your hand or wrist. If you've experienced any of these, please check out the related link or video. And we will have more videos to come to better educate you and help you to make a wise decision to help with your future health. As always, thank you for joining us. Stay safe. Have a great day.